It's 8:13 a.m. Robert, 67 years old, is pouring his usual cup of coffee. Suddenly, the cup slips. His right hand isn't cooperating. He tries to speak, but nothing comes out. He thinks, maybe I'm just tired, maybe it's my sugar levels. But inside his brain, the damage has already started. In the next 5 minutes, he will lose nearly 10 million neurons. What happened inside Robert's brain in those first 300 seconds could determine whether he walks again or not. Today, I'll take you minute by minute through what really happens in your brain the moment a stroke begins and what you need to do before it's too late. When people think of stroke, they imagine sirens, a person collapsing, slurred speech. But that's not always how it begins. In fact, over 70% of strokes start quietly with just a moment of confusion or a slight stumble. I've seen this too many times in my clinic. A patient comes in days later saying, "I felt strange that morning, but I thought it was nothing." Trust me, it's never nothing. In this video, I'll show you what happens inside the brain during those first 5 minutes and why acting fast could save your memory, your speech, or even your life. A stroke usually begins when a blood clot blocks a vessel in the brain, cutting off oxygen and glucose. It's like a power outage in a city. Lights go out, traffic freezes, communication stops. The brain doesn't store oxygen, so when blood flow stops, cells begin to suffocate within seconds. Neurons stop firing. The communication between brain regions breaks down. First comes confusion, then weakness, then silence. And here's the hard truth. The longer the delay, the greater the damage. But catch it early, you have a real chance of recovery. Let's go back to Robert and break down what's happening minute by minute. Minute 1. Blood flow is blocked. In Robert's case, it's the left middle cerebral artery, the area responsible for language and motor function. Neurons begin to fail. He drops his coffee. He tries to say, "I need help," but his speech is garbled. He's confused, but still conscious. Minute 2. Brain cells begin to leak potassium and glutamate, leading to toxic buildup. Robert's wife notices something's off, but he insists, "I'm fine." His face is slightly drooping. His right arm feels heavy. Minute 3. Cell death accelerates. Inflammation begins. Every minute equals 2 million neuron lost. If this continues, Robert may never speak clearly again. The penumbra, the zone that can still be saved, is shrinking fast. Minute 4. Swelling in brain tissue begins. Nearby neurons are affected. If no action is taken now, disability is almost guaranteed. But if he gets help this very minute, medication like TPA could reverse the damage. Minute 5. Robert collapses. His wife finally calls 911. EMTs arrive within 10 minutes. He receives clot-busting treatment at 8:43 a.m., exactly 30 minutes after his first symptom. He survives. He speaks again. He walks with rehab. But the doctor told him, "If you had waited just 10 more minutes, you might not be here." If you or someone you love ever feel sudden numbness, slurred speech, or confusion, don't downplay it. Don't wait it out. Don't sleep it off. I always tell my patients, let the doctors decide, not time. Call 911, even if it turns out to be a false alarm. Because if it is, a stroke minutes matter. If Robert's wife had waited until after breakfast, his entire future would have looked very different. And I've had patients who waited and now live with memory loss or speech disability for the rest of their lives. Trust your instinct. Listen to your body. Act fast. You won't regret going in, but you may regret staying home. A stroke doesn't shout, it whispers. In the first 5 minutes, your brain is screaming for help, even if your mouth can't say it. Learn the signs. Trust your instinct. And always choose action over guessing. If this video helped you, share it with someone you love. Because one day, those 5 minutes could belong to them. I'm Dr. Ethan Wells, and in the next video, I'll reveal 3 common blood pressure myths that are putting seniors at risk every single day. Hit subscribe, and I'll see you there.